My name is Muhammad Tayyib Aleem and I am going to present a clinical case of benign prostatic hyperplasia in a dog and its successful treatment with Finesteride based on a published case report. Before we begin, please subscribe to the channel and click the bell icon so you don't miss upcoming veterinary theriogenology case discussions. Start with dog's signalement and presenting complaint. Then we will briefly review the history. Then we will move on to the clinical findings, followed by the diagnostic workup. After that, we will define the final diagnosis and main differentials, and then outline the treatment plan and follow-up, and then look at the clinical outcome. We will finish with a focused discussion on the pathophysiology, and then we will wrap up this discussion with conclusion. Now, let's start with the signalment and presenting complaint of this dog. This case involved a 4-year-old male intact Welsh Corgi that was being used as a stud dog. The dog had been adopted internationally 1 month before presentation, specifically for breeding purposes. He was presented to the hospital with intermittent hematuria, meaning that episodes of blood in the urine were occurring off and on rather than continuously. In addition, serosanguinous exudate was observed at the urethral opening, that is, a mixed clear and blood-tinged discharge from the tip of the penis. Because the dog has been adopted for reproductive purposes, BPH needed to be treated in a way that would preserve his fertility. These types of signs are commonly associated with prostatic disease, including benign prostatic hyperplasia, prostatitis, or cystic changes within the gland. Next, let's briefly review the history of this breeding dog. The dog had been internationally adopted about 1 month before presentation, specifically for breeding purposes. Approx 1 week before admission to the hospital, the dog was used for natural mating. After that breeding, the owner noticed new problems. The dog became depressed, frequency of hematuria increased, and anorexia was observed. Because this dog has been obtained for reproductive purposes, it needed to undergo treatment for BPH while maintaining its fertility. That historical details are crucial because it essentially rules out castration as a first-line option and pushes towards medical management strategies. Now, let's look at the main clinical findings. On physical examination at admission, the dog was found to have mild dehydration. Rectal palpation revealed an enlarged prostate with a relatively smooth border. Routine tests didn't show any abnormal findings. Normal hematology and biochemistry helped rule out significant systemic diseases. Clinically, the dog continued to show intermittent hematuria and serosanguinous exudate from the urethral opening at the time of presentation. These ongoing signs are very typical for canine BPH. Now, let's review the main diagnostic tests that were performed in this dog. On abdominal radiography, the prostate was visibly enlarged. Retrograde urography was performed to evaluate the relationship between the prostatic urethra and the prostate parenchyma, and no damage to the prostatic urethra was observed. Now let's look more closely at the abdominal ultrasonography and the needle aspiration findings. While image A is highlighted, we can see the overall prostate and the length and depth of the gland were measured at 2.62 by 4.12 centimeters. While image B is highlighted, two cysts within the parenchyma of the prostate are visible, and they were measured as approx 0.60 by 0.39 centimeters and 0.38 by 0.58 centimeters respectively. Fine needle aspirate examination of the prostate confirmed benign prostatic hyperplasia, and diagnosis of intraprostatic hematocyst due to vascular development was made based on ultrasonography and aspirate findings. Serosanguinous cyst fluid was observed in the prostate. Now, let's summarize the final diagnosis in this case. In summary, the imaging features together with the fine needle aspirate confirmed a diagnosis of benign prostatic hyperplasia with an intrahematocyst in this intact breeding dog. Now, let's look at how this dog was treated. Because this dog was a breeding animal and needed to maintain its reproductive ability, medical management using Finesteride, marketed as Proscar, was selected instead of neutering surgery. Finesteride, at a dose of 2.5 milligrams, was administered orally once a day as the chosen treatment regimen for this dog. The treatment effects were assessed through regular monitoring of the prostate size, and the dog's reproductive ability was also followed during the medical management period. So the plan was not only to treat the prostatic enlargement but also to keep checking that the prostate continued to regress and that the dog remained fertile while on finasteride. Now let's see the clinical and reproductive outcomes of finasteride therapy in this dog. Clinically, after just 2 weeks of oral finasteride administration, the dog's symptoms, including hematuria, were no longer observed. When finasteride at 2.5 milligrams once daily was continued for 5 months, the prostate size decreased to 2.34 by 3.53 centimeters on follow-up ultrasonography. So compared with the initial measurements, there was a clear and measurable regression of the prostate under medical therapy. The intraparenchymal cyst within the prostate was also decreased in size and was measured as 0.22 by 0.64 centimeters on the follow-up scan, as shown in the figure. During the treatment period, the dog underwent 2 natural matings at 3rd and 4th month of finasteride therapy and successfully impregnated female dogs, confirming that its reproductive ability was maintained. Now let's throw some light on the pathophysiology of BPH in dogs. Benign prostatic hyperplasia develops through an increase in both the number and the size of epithelial cells within the prostate. Dihydrotestosterone, or DTH, play an important role in normal prostatic development and in the progression of BPH. BPH is characterized by notable proliferation of both the glandular and stromal components of the prostate. Mechanism of action of finasteride. Now let's briefly look at the mechanism of action. Under normal conditions, 5-alpha reductase converts testosterone into dihydrotestosterone, or DHT, within the prostate. Finasteride is described as a non-steroidal anti-androgen that works by inhibiting the enzyme 5-alpha reductase, as you can see in the figure. By inhibiting 5-alpha reductase, finasteride lowers the DHT concentration inside the prostate and as a result reduces the size of the gland. Finasteride doesn't change the blood testosterone level and therefore has no effect on sperm production. Finally, let's discuss with this case tells us about managing BPH in breeding dogs. In unneutered male dogs, benign prostatic hyperplasia is most commonly treated by neutering surgery to reduce hormone secretion, but this approach inevitably leads to infertility. For dogs that are planned to be used for breeding, medical management with drug therapy is therefore preferred because it can reduce the size of prostate while maintaining reproductive ability, just as in this case. In vet medicine, other drugs can also be used to treat BPH, include estrogens, steroidal and non-steroidal anti-androgens, and GnRH agonists. With relatively long-term use of finasteride, there may be changes in sperm properties because of decreased prostate fluid, and the prostate size can increase again over several months after the drug is discontinued. For this reason, regular monitoring and semen analysis are important to describe how long to continue treatment and when to withdraw it. So, in conclusion, this case shows that finasteride can successfully treat benign prostatic hyperplasia with an intraprostatic hematocyst in a breeding dog. Clinical signs such as hematuria disappeared, the prostate and cyst size decreased on follow-up ultrasonography, and natural matings resulted in pregnancies, confirming that fertility was maintained. Overall, this supports the clinical use of finasteride as a practical non-surgical option for managing BPH in dogs that needed to remain reproductively active. That's all about BPH in dogs. Thank you.